He lines up a shot. He kicks. Oh, he sprained his knee. One of the other injuries we can definitely help out with are different kinds of knee aches and pains in and about the knee itself. There are many reasons why the knee can hurt. There are many structures around the knee that can hurt. The big thing is very quickly get a great assessment of what's going on, what's possibly injured. Do we need to send you out for imaging? Do we need to get that sent off to different specialists, something like that? Once we clear those and rule those in or out, we can move on to the next step of the rehab and the treatment process. Assuming this is not something that needs surgery, so this is just maybe something that's like a light sprain or strain or something like that. You know, you lightly sprain some ligaments or something like that on the either side of the knee, or you strain some muscles and stuff on either side of the knee as well. The big thing is, one, keeping getting those calmed down. We want them to feel happy, healthy, and safe, because that's when the body can heal and recover and start to feel better, and you can get some more performance and strength and endurance built up in those structures. But two, we also want to make sure that we get some things in and around the knee itself moving or checked out and moving a little bit better too. Sometimes that is definitely getting some things moving around the foot and ankle on that same side, and or even the hip, because what's going on above and below the knee a lot of times can have an effect on what's going on at the knee itself. So if the knee is hurting, or even if the muscle kind of like the quad, the big muscle up top is hurting, a lot of times that can cause some issues at the knee, but a lot of times too can be some issues up here at the hip itself. So getting a great assessment, we want to figure out, like I said, what's moving well, what's not, and where to go from there. We'll plug in some good exercises to really start targeting that stuff. And the big thing is going to be building up some strength, building up some endurance, and the muscles that are sore, stiff, and weak right now, because we want the body to, with the strength and endurance, the body feels safe. It's able to control the movements at the knee and the hip better, and it's better able to express your full athleticism on the court and on the field. So if you have any issues with knee pain, we're in the Kansas City area. We'd love to help you out. If you're having, one of the things we also can do with that, treating the knee itself is some soft tissue mobilization, some active release technique. We can do some soft tissue, some muscle scraping. We can do some muscle taping. We can use dry needling to help get stuff calmed down. We can use the dry needling to help kind of get some stuff like activated and kind of going. We can also do, on the chiropractic side, get some joints moving, like I said, above and below the knee, the low back, and that kind of stuff, to really make sure that you are moving and grooving and performing at your best when it's time to get back there on the field, on the pitch, on the court, or anything you're trying to get back to in life in general. So feel free, if you have any questions about knee pain, drop them below, or feel free to reach out to us, and we'll hopefully see you guys soon. Bye.